surgery, there are four main ones. First, cataract surgery is the bread and butter for general ophthalmologists, and it is the most common outpatient surgery, with 3 million surgeries performed every year in the US. It makes sense, since cataracts is the leading cause of vision loss in the world, and everyone gets it, assuming they live long enough. Phacoemulsification is the technique used, whereby ultrasound technology breaks up the cataracts and a vacuum sucks it out. An artificial lens is placed in the eye with specifications unique to that individual's refractive error. Second, cornea surgery, including corneal transplants. Corneal surgery also includes LASIK or PRK, another form of laser eye surgery that isn't as well known as LASIK. Third, glaucoma surgery, which includes placing tiny tube shunts or performing trabeculectomies to redirect flow of the fluid in the eye. And lastly, retinal surgery, which includes repairing retinal detachments, macular hole repairs, removing foreign bodies within the eyeball, and even lens removal following a complex, except for surgical retina and oculoplastics, which are each 2 years. Cornea deals with surgical and medical management of corneal eye diseases, and includes refractive procedures like LASIK, PRK, and SMILE, which is essentially an even less invasive option than LASIK. Surgical retina is a 2-year fellowship primarily focused on retinal diseases from diabetic retinopathy and retinal detachments. Compared to other subspecialties, the lifestyle is not as optimal as there are occasional emergent add-on cases like retinal detachments, but even these can generally wait until the next morning. Medical retina is a 1-year fellowship dealing with medical management of similar retinal diseases. You'll be performing lasers and injections, but no retinal surgeries. Glaucoma fellowship will have you trained in medication, lasers, and surgery to decrease intraocular pressure. Oculoplastics is a 2-year fellowship dealing with orbital diseases and adnexal structures such as the eyelids, tear drainage system, and the face. It includes both aesthetic and reconstructive surgeries. With a pediatric fellowship, you'll deal with all ocular issues that children have, ranging from glaucoma to retinopathy of prematurity, meaning abnormal blood vessel development in the retina in premature babies. However, your bread and butter will primarily be refractive errors, amblyopia, and strabismus, meaning misalignment of the eyes. Amblyopia is when the visual pathways in the brain are not developed properly due to poor visual input, such as from strabismus or refractive error, and this can result in permanent vision issues in children if not properly corrected before the age of 7. Neuro-ophthalmology is concerned with how the nervous system relates to the eye and vision, meaning you'll be dealing with optic neuritis, optic neuropathy, double vision, and paralysis or spasms around the eye. Ocular oncology is an evolving field dealing with primary and metastatic tumors of the eye and orbit. You'll be working closely with oncologists, radiation oncologists, and dermatologists. Completing a uveitis fellowship makes you the specialist for infectious and inflammatory disease in the eye, particularly those of the uvea, which is at the front of the eye, more specifically the iris, choroid, and ciliary body. Ophthalmology is unique in that it combines medicine, office procedures, and surgery into one practice. It's also a highly innovative field with cutting-edge technology. For example, ocular coherence tomography, or OCT, uses near-infrared technology to produce cross-sectional pictures of a patient's retina, visualizing each layer independently and measuring their thickness. In terms of lifestyle, it's hard to beat. You won't have to come in on weekends, and if you're on call, it's generally pretty light. For the most part, you're working a regular 8-to-5 job. Compensation amongst physicians is in the upper third, with an average salary of $366,000 per year. As a procedural specialty, compensation is largely a function of how many procedures you perform. If you can increase efficiency and do an extra few cataract surgeries on a given morning, your compensation will reflect that. The lifestyle is phenomenal as an attending, and compared to other residencies, particularly surgical, ophthalmology is far more laid back. Ophthalmology is also unique in that it's a highly visual field, no pun intended. A great deal of your diagnosis will depend on your exam. It's one of the few fields remaining where the physical exam is vital, and being able to diagnose a patient from a physical can be quite gratifying. Lastly, you'll be highly specialized in a very specific area. Many systemic health issues manifest in the eye, so there will be times that you're the first physician to catch an infectious disease or even cancer. Because of your high degree of specialization, you may even catch important findings on imaging that even radiologists may miss. One example that comes to mind is a teenager with trauma to the eye during a sporting event resulting in a fracture to his orbital floor. The inferior rectus muscle of his eye was entrapped by the fracture, so that when he tried to look up, not only was he restricted, but he had a drop in heart rate known as the oculocardiac reflex. This happens because the eye muscle contains sensory nerves from the ophthalmic division of the trigeminal nerve. When the entrapped muscle tries to move, these nerves can become activated, which then synapse on the vagus nerve, resulting in bradycardia or a slower heart rate. The flip side of being so highly specialized and independent is that you may feel more isolated compared to other specialists. Whereas most of medicine is moving towards incorporating teams, you won't be as deeply involved in coordinated care as an ophthalmologist, apart from the occasional consults to rheumatology, neurology, endocrine, and of course, the patient's PCP. There's also a steeper learning curve in residency, as much of ophtho is not emphasized in medical school. You'll be doing new imaging, a new and more detailed physical exam, and learning about pathologies that weren't highlighted in medical school. Depending on your personality, you may not